Good day, ma'am. I am Julian Luyas, and today I'll be performing wound care. So first thing to do is review medical orders for dressing change procedure. After that, explain procedure to client and instruct client not to touch wound area or other sterile supplies. So, good morning, ma'am. Ako din si Julian Luyas, ma'am. Ako imong nursing assistant karon. Kinsa ganito imong ngalan, ma'am?
John D. Luyas.
John D. Luyas. Pila na imong edad, ma'am?
12.
Okay ra ka, ma'am? Okay ra ka?
Okay na.
Okay, so karon na matong buhaton mo, itong limpyon imong samad para ma-okay na, para dali siya maayo. Okay ra, ma'am? Oh, sige. And then, after that is closed room or cubicles, curtains, and windows. Tatay close. And then, we're gonna close the doors. And then next is position client comfortably and drape using bath blanket and wherein we are going to expose only the wound site. So, kung i-drape, ma'am, okay ra ka, ma'am? Okay ra ka nga position or
okay
usbo na to? Okay ra. Okay, good. And also, it is important to place waste receptacle within reach of work area. So, I have here the receptacle. And now, apply face mask and protective eyewear if required. And wash hands thoroughly, but I am going to perform hand hygiene. And then after that, put on clean gloves and remove tape, bandage, or ties in the wound. And now it's time to remove tape, pull parallel to skin, and pull towards dressing and remove remaining adhesive from skin. And then with gloved hand, carefully remove gauze dressing one layer at a time, taking care not to dislodge drains or tubes. And then keep solved undersurface away from client's side. So, itong hinahinayon, ma'am, ha? Itong i-remove ang mga tape carefully and slowly. So, if dressing sticks on a wet to dry dressing, do not moisten it. Instead, gently pre-dressing and alert client for possible discomfort. So, ato siya ingnan nga, pagkuhaon na nato, ato siya ingnan nga, ma'am, basig, masakitan ka, ma'am, ha, inar ko, ma'am, ha, medyo masakit-sakit dyan, ma'am. Hinay-hinay ka, ma'am. Okay. And next is observe character of wound and amount of drainage on dressing and appearance of wound. And then after that, we're going to dispose the soiled dressing in waste receptacle. Ito na nabutang. And then after that is remove gloves by pulling them inside out and dispose it in the waste receptacle. And now it's time to open sterile dressing tray or individual wrapped sterile supplies placed on bedside table. So I have here the separated wrapped sterile supplies. And now we're going to proceed to dry dressing. So in dry dressing, the first procedure is open bottle of solution and then pour it into sterile basin. So I have here the solution. And now apply sterile gloves, and it is important to maintain the sterility of the gloves. And now it's time to inspect wound for appearance, drainage, and integrity. Avoid contact with contaminated materials. And now, cleanse wound with solution. Use a separate swab for each cleansing stroke and then clean from least contaminated area to most contaminated area. So I have here the swab, the sterile swab. So one stroke. To the most contaminated area, which is the sides of the wound. And then after that, and now use dry gauze to swab in same manner. I have there the sterile gauze. It's too big, so ito siyang pagamyan. With the same manner as in step 16A to dry wound. Ito siyang tukan para mamala. The same manner Japon, from least contaminated to most contaminated area. Going to use 1 dry gauze for each stroke. And after that, apply antiseptic ointment if ordered using same technique as for cleansing. So, pag naatay ointment, ato siyang i-apply. And after that, apply dry sterile dressings to incision or wound. And now, after the procedure, we're going to apply loose woman gauze as contact and cut 4x4 gauze flat to fit in around the drain. And then, pre-cut gauze is also available. So, the gauze here is already 4x4, so I don't have to, or I don't need to cut it anymore. Hindi siya mabre. Ato kagaling. Then we are going to fit the cut gauze in the wound or the incision. Okay, ma'am ha? Okay ra ka, ma'am?
Okay na, ma'am.
Sige na. Mayo. Yun. And then we're going to apply the first layer. And then after that, apply the second layer of gauze. So I already put the second layer of the gauze here. And lastly is apply thicker woven pad. So I have here the sterile woven pad. So let's apply. And we're going to put tape side by side in order to ensure that the gauze is safely placed. So that's it for my dry dressing. And now let's proceed to wet dry dressing. So first thing to do is pour prescribed solution into sterile basin and add fine mesh gauze. So I have here the prescribed solution. Put here. And then add the prescribed fine mesh gauze. And then after putting the fine mesh gauze in the solution, let's now proceed to, let's apply sterile gloves. Tatong kamot dari man. Di na siya masulong. So after that, let's inspect wound for color, character of drainage, and type of suture and drains. So i-check ang wound. Okay, ma'am. And after that, cleanse wound with prescribed antiseptic solution or normal saline. Clean from least to most contaminated. And after that, it's time to apply moist fine mesh gauze as a single layer directly onto wound surface. If wound is deep, then gently pack into wound with forceps with all wound surface are in contact with moist gauze. I'll perform ko na last na 1, 2, 3, go. If it is properly placed, then we are going to apply dry, sterile 4x4 gauze over wet gauze. And then, apply tape over dressing. Since it's all done and I am able to tape the gauze properly, and then it's time to remove gloves and dispose waste receptacle and remove mask and eyewear. And now, assist client to comfortable position. And then after that, dispose of supplies and wash hands. So, you remove, ma'am. Okay na kasi mong kuan, ma'am, position, ma'am?
Okay, ma'am.
Okay, good. Dispose everything and wash hands or do hand hygiene. So that's all for my wet dry dressing, ma'am, and have a nice day.